Hello, hello, hello. Happy Tuesday. Happy Tuesday, THLers. Hello, welcome to Abby Tyler's Healthy Living Tuesday show. My name is Abby Tyler. I am your host. I'm a practicing family nurse practitioner, content creator, community health volunteer, and contribute health contributor to other forums. Welcome to all of you joining me from Focus on Liberia, from YouTube, Abby Tyler's Healthy Living page, and Abby Tyler's Healthy Living as well, and all the other forums as well. Could you just please give me 1 second and I'm just going to share this because there was a little delay. So 1 second. Again, how's the weather in your area? It was about 100 degrees over here today. And I heard it was like really piping hot in England where they usually get all that rain. So let me just give me 2 seconds here and I'll be right with you guys. Alrighty. And post. And one more. Post. Okay. How are you, all of you today? Hope all is well. As you can see from the title, top 10 reasons for seeing your doctor, making your routine visits. Now, I am not a dentist and I'm not a dental hygienist or anything, but in my field, again, like I said, we have to know a little bit of everything. And I also take care of patients who I have to send to the dentist for care, and also some to send patients to me too for medical care. And everything that has to do with your mouth also affects your overall health. So that's why I'm talking about this today. I did the eye care last week and I'm doing the dental care this week. As always, my disclaimer, whatever I say here should not take the place of you seeing your own provider. When I say provider, I'm meaning doctor, NP, or PA, whatever, or whoever they call your providers in where you are. Okay, so let me start. I'll take a little sip of water. By the way, for everybody out there, COVID is back. It never left. So please be careful. Continue to do what you have to do to keep yourself safe, especially if you have pre-existing medical illnesses that will make you much sicker, like your diabetes, hypertension, high blood pressure, kidney disease, asthma, and any kind of pulmonary diseases. And if you're elderly or very young, okay, and other disease are high risk too. Okay, so 1 second. Okay. Alrighty. So most of it I'm just going to be reading right through, and then I'll look and see if there's any comments in between. Alrighty. So let's start here. I'm going to go over to my notes because I saw this really nice article from this dentist office, and I did this, and I'm just going to add my own personal practices. Okay. So 10 reasons for going out. So I'll do my disclaimer already. So again, like I said, I take care of patients who they come to me and they have infections in the gum, and I tell them go to your doctor, your dentist. And sometimes they don't have the time to go to the dentist. Some people don't have dental insurance. Dental insurance can be very expensive. Some employers don't provide it, some do, and some don't provide like a good amount. So most of it you have to pay out of pocket. So the best thing is, so if you do have it, go to your dentist at least every 6 months so you can ward off any kind of problems. So the American Dental Association recommends that your child goes to start seeing a dentist at about age 1, when they start having enough teeth in their mouth, or like 6 months after they start having enough teeth in their mouth. But of course, you want to be brushing every twice a day, and flossing also. Brush and floss also twice a day. Sometimes it means 3 times a day you have to do that, especially if you eat foods that are really sticky. So let's start with number one reason for going to seeing the dentist routinely is the dentist catch minor issues before they become major issues. A routine dentist office typically consists of the two main components: the cleaning and then during examination. So the hygienist goes in there and cleans your teeth. Some of you will probably need, or some of you, most times you need, I think like every other year you so you may need some x-rays. So they do your x-rays, and then the hygienist will go in there and clean your teeth and do everything. And then the dentist will come in and look it all over, look at the x-rays, see if there's anything there. If there's nothing there, they make their examination, look in your mouth, look in your throat, look for other diseases that may appear that you cannot see just by looking at your mouth, because most people don't look into their mouth every day. And that, again, like I said, dental care can be very expensive. So by doing that every 6 months, the dentist can see what's going on there and catch that long before it becomes very bothersome and more expensive to control. Okay, so by getting routine dental care, you can ensure that simple problems do not turn into more complex ones, helping you avoid the physical and financial burden of lingering conditions. Okay, number 2, to prevent tooth decay and with professional cleanings. In as much as I don't care how well you brush your teeth every day, and you can be the most meticulous cleaner and flossing and all that too, it still doesn't take the place of you going to see a dentist every 6 months to get professional cleaning, because the tartar and everything build up there, and the brushing cannot take that alone. You have to go there and let this scrape everything off, and let them scrape everything off, and go in there again, like I said, look in your tongue, making sure they're looking for other things. There's so many other things, gum inflammation and everything else that the dentist can look for. So the tartar builds up and hard to reach places, and plaque that is not removed can harden up. You cannot usually remove tartar by brushing and flossing it alone, so you need to go there. And this practice helps prevent tooth decay, which ultimately leads to gingivitis and cavities and other form of other gum disease. Okay, now you go to your dentist first, and then there's any major other issues, they can send you to the periodontist, who can do more surgical work, and orthodontist also can do cosmetic surgery like braces and other stuff. Okay, number three, enjoy your food. If your teeth don't fit well, you're not going to be able to enjoy your food well, because you have to be able to chew. Let me make sure here this is loud enough. Okay. You have to be able to chew well. And if you can't chew well, you're not going to be eating. You're going to be cutting. You have to cut your food in smaller pieces. You can't eat certain kind of foods, and that's not good. You have to have a good quality of life. So you have to eat food from all the major food groups. But if your teeth hurting, you're not going to be able to eat. Also, when patients come to me and they have other issues with their teeth, because I look at their face, you have to look at the eyes, the nose, and the mouth, and the throat, and every time you see them, the ears and all. So if I look there and I see something there like poor dentition, meaning that anything that's going to be causing reason why you're losing weight, is it because your food, you're not able to eat your food, especially for older people and people who can take care of themselves. Usually that's where they have that problem. So if you're not enjoying your food, then chances are you're not going to be eating healthy, and that can cause other medical problems. So also you want to enjoy your food. That's the reason you go to your dentist, and they check your teeth, the integrity of your teeth, to make sure they're strong enough that you're eating the right kind of food, and you're eating food from every major food groups, and you're not holding back because you can't enjoy your food. Okay. Also, screen for oral disease, oral cancer, and gum disease, and other conditions. All right. One of the most important aspects of routine dental checkup is the oral exam, cancer exam, because you have to take your tongue and kind of move it back and forth and look in there and look at your tongue. I had a patient that went to that he came to me. He's new. He went to his dental care, and he had something in the back of his throat. The dental was looking there, and he said, "Okay, I want you to go see. You have to go see your family doctor." He said, "I don't have a family doctor." I said, "Well, then it's important that you go see your family doctor, set that time up, and then your doctor can send you to the ear, nose, and throat doctor, so to make sure whatever is growing in your throat that's not cancerous." So the dentist looks all through that after they clean your teeth, all there, and the dentist looks, take your tongue and put it this way, look it side to side, and look all into your mouth with the lights and all. So like I said, normally you won't be able to see that by yourself. So that's important. Alrighty. Your hygienist or dentist will also be looking for signs of gum disease and all that. So brighten your smile and boost your confidence. Of course. I mean, who doesn't like a beautiful smile, regardless of how it can be subjective, but when you're happy, or when when you meet people, the first thing they see, to look at your eyes, and then to look at your smile, and people look at your mouth, and your mouth says a lot about you, even though sometimes in certain conditions, like again, I said it's subjective. But when you're smiling, people, and people see your teeth and see how healthy they look and how nice and white they look, or relatively white, that boosts your confidence. Because if you have missing teeth, or you have something going on in your mouth, you're not going to want to smile. You're not going to feel as confident. So it's important that if there's something going on in your teeth and they're kind of crooked, or they're in the way where you always had issues with, where one was missing and you couldn't afford it, all that affects your regular life. Because it's like, okay, I want to put my picture up. Well, I don't like to smile because I'm missing a teeth, or my teeth is brown over here, or I'm missing something, or they look kind of crooked and they don't show good on pictures. For some people, that can say, oh, well, that's just vanity. That is not vanity, because everybody wants to feel good about themselves. So by going to the dentist, and the dentist can then say, okay, let's see what we can do to put, maybe we can put some braces on. And there's so many different kind of braces nowadays. You don't have to wear the metal ones. They're the ones where even as you get older, they have the one where I think it's Invisalign, where it looks like a little plastic case. You just put that on your mouth. You have to think about it. I think you have to take it out every time you eat. So you have to make sure, because it's kind of expensive. So when you take it out, make sure you put it in the cup. My friend used to take hers and put it in the cup, and she'll eat, rinse her mouth, and put it right back on. And in a couple of years, your teeth are straightened out, and you have different ones. So they'll send you to the orthodontist. They will do the consultation, and then you'll be paying some money out of pocket. It's not cheap. But if it's something that's bothering you, and most of them have payment plans too, because my kids both have road braces, and I took them and we had payment plans. My insurance company paid for some, and then some of it was out of pocket. So, but like I said, they have payment plans. You can pay into it and do that if it's something that's really bothering you over the years. If it's something that you feel comfortable with and it's okay for you, then fine, you can go ahead and do that. But just continue to do that and get your teeth fixed, and it brightens up your confidence, of course. And also, all of course, like I said, as you get older, you start losing your teeth, and you're elderly person. Elderly people start feeling bad because like they're losing their teeth. Take the medical part where they're not chewing and it's not safe for them to eat harder foods. Just the fact that you may start losing your teeth, maybe for other gum gingivitis and other diseases over the years, you start losing your teeth very early in your 50s, 40s, 50s, and 60s. You still have a whole lot of life left in you. So you can go, they can put placement in there. They can also put dentures in. They have dentures where you can put in and take out. They have partials where you don't have to wear the whole dentures. You can just put the part that's missing, you put that in. And again, like I said, it can be expensive. So you want to make sure when you get that, you put that somewhere safe. So when you go to bed at night, and some people don't like to take their teeth back and forth. So they have the dental implants where they can set you up for that. And you put that in your mouth and it stays there. Okay, so all of this is checked by going regionally to see the dentist, and then the dentist can refer you to all the specialty doctors. Okay, again, like I said, and then also for people who snore, I talked about snoring the last time. Sometimes people snore and they might need a mouth guard that keep their mouth in a certain way where they're not snoring. So the dentist can also do that. And some people who grind their teeth a lot, that can really wear down their teeth enamel and all. The dentist can also work on that and protect your overall health. Most people don't know that your dental work, your oral hygiene, and all that also affects your regular life. Okay, your regular health. So they said, did you know a study led by University of California, Berkeley determined that women who get dental care have a lower risk of heart disease, fewer strokes, and other adverse cardiovascular outcomes. Similar to the symptoms of some systemic diseases such as diabetes, lupus, rheumatoid arthritis might first appear in your mouth. Should your dentist spot anything worrisome on your routine visits, he or she can bring that to your attention and recommend that you see your primary care physician. Again, like I said, we all work together. We send patients there, they send patients to us. Sometimes some patients never come to see the primary doctor. They only go to see the specialist if they don't need a referral and all that, or they just been following them already. So it's important that you go and see that. Again, some of these diseases are not, they can be assessed with a naked eye, or they can be assessed with an untrained eye. So that's the reason why you go. And dentistry is a whole different specialty that we don't put that much on in school, because it's a whole different schooling and different stuff. So I'm just giving, this is all these articles, everything I'm reading to you is from part of my practice, the part I do, and also from a dental report. Okay, so by going to your dentist, you also stay tuned with your overall health, your dental health. So generally speaking, people who visit their dentist every 6 months are more in tune with their overall oral health, and those who then do not. For example, if you visit your dentist regularly, you're more likely to notice subtle changes like teeth or gum sensitivity, because some people have really cold teeth and very sensitive to cold water, as well as potential problems areas to bring to your dentist's attention at your next appointment. By staying on top of your dental health, you're more likely to recognize problems quickly and resolve them before they become ongoing problems. So again, if you're serious about, people who really concerned about their health and all, they will go to the dentist every 6 months. And then some people you have to go maybe every more than that, especially if you have other issues. They might say come every 3 months, come every 1 month until that issue is resolved. Okay. You want to keep an eye on your past dental work, because some people, if they do, like say they had a crown placement or they had something, sometimes the teeth, as you get older, the teeth can shift. Or if you have any issues like weight gain or anything else that you had over the years, can cause that. Because I had a crown placement in my mouth. I had and I was there for 10 years. And then one time, I think it was like 2 years ago, and I'm saying like, why does it feel like every time I try to chew on this side, it's burning so much and it hurts so much? And I went there, sure enough, I had infection there, and the crowning that was there, I already started moving around. So they had to take it out and they had to put another one in. Trust me, and that was not pleasant, because it's like my body was not responding to the anesthesia that well. So I was screaming at doctors like, if you're scaring the other patients, but I was like, I'm trying not to. Just tell me it's going to be over soon. So most dental work don't hurt. It's just that certain ones, them, I mean, as with anything, if you're going to go to the chiropractor, you go into the orthopedic doctor, or go into anywhere that certain things is not too pleasant, but they have different painkiller that can kind of not sedate you, but put you to where it's comfortable enough. But when you go for your regular cleaning, you don't need all that. So don't think that they're gonna put you there and be causing you any pain. No. And most dentists now, they know that, and they're very sensitive to everybody's pain, everybody personal pain, their pain threshold. Like some people can sit there and get dental work and no problem, and some people need a little bit more medication to help them along the way. Right. And also when you go to the dentist too, when you fill up your form, they're gonna ask if you have any issues with your heart, anything that you saw a cardiologist for in the past, or another doctor that says you may need certain medications, maybe something for anxiety, you may need some kind of antibiotic to protect your heart when you go for your dental work. Okay. And sometimes if you've had major issues before with anesthesia, you want to make them aware of that, because again, like I said, if they have to do major work with you, they have to give you some anesthesia at the area, a little bit, and it's localized anesthesia. So meaning it's just here, but you can still absorb some of that, and that can affect your heart. So it's very important that you make them aware of that. Okay, so I'm going to just look here for a second and take a sip of water and take a break. Welcome again. Let me just look in here. Okay. Hey, Abby, thanks for the education information. Thank you, Moses, and thanks for joining me last time. Hi there, Glendy. How are you? Okay, so I'm going to go back here. And okay, so let's keep an eye on dental works. The last one I did. Empower yourself with practical knowledge. As they said, pick a practice that, again, like I said, that communicates with you, that is sensitive to your pain. Communicate good dental habits. Create an open and honest environment where patients can ask questions without fear of judgment or embarrassment. By understanding why certain dental habits are encouraged and others are discouraged, you can arm yourself with practical knowledge and put into practice to take control of your own dental health and well-being. So if you go somewhere and you're not jiving with that dentist or the office and all that, you don't stay there. You don't have to stay there. I'm not saying go there and just leave at the first thing, because sometimes you may get along with somebody in the office and not the person. And if that practice has like more than one provider, you can always the provider you get along with, you can say, I'd rather have this one. Every once in a while, that person may not be there. So it's best to try both and then see which one you like best and say, this is the one I'm going to be with. Over the years, my dentists, they were much younger when I was much younger. They were older, and now they have both retired. So we have a whole different set of dentists in there now. So you have to get used to people as you get older. Dentists get older, doctors get older, and you have to get used to that. So a little bit of change. If you're not, you have to be comfortable with change, because like I said, there would maybe other people there who you get along with, and then sometimes you don't get along with them. But just work it out to try to see. I did a show on how to you pick a provider. That also goes for dentists too. Okay. So send a good example for your children. If your children see you go into the dentist every time, especially when they're young, like I said, the first time to go to see the dentist is about 12 months, to recommend about 12 months. So if you're going every time, and the best thing to do is like when you go with them. That's what I used to do with my children. When I make the appointment, I go the same time they go as well. So we both just went together, and two of them, and I went there too. And they get used to it. Of course, when children get to a certain age, like 18, when you don't have any more control over where they go to the doctor's office and they don't see anything wrong with their teeth, they're not going to go to like way later, maybe to like in their 30s. So, but at least you've already, put that into them, that it's important that you go get your teeth fixed and all. And when they do get their braces and all, it's all about making sure they brush their teeth, and they have to follow the braces instructions very, very clearly. If they tell you, say you cannot eat this kind of food, even though when you're like in your 10, 11 years old, you want to eat like some hard apples, you want to eat some hard candy and popcorn and all. No. So they have to have good counseling saying, if we go get your teeth fixed, these are the things you have to do, or you're going to have to wear braces for a very long time, because usually it's about 2 to 3 years. Some children have to wear it longer depending on how old they were when they started it, and the damage to their teeth, or hard damage to their teeth were at the time they got braces. So also, that also goes for older adults. Regular adults, if you got braces later on in life, And by the way, if you want to fix your teeth, fix your teeth. Don't let anybody think that you're too old to wear braces. Okay, like I already said, there are many other kind of braces you can wear out there. So it's good. Teach your kids that it's important. Go every 6 months as recommended, or as often for your regular dentist. And if you have to go to the orthodontist and periodontist, make sure that they're following through with that. And 10, I think I did. Oh, yeah, it's to save money in the long run. Like I said before, one of the main reasons to visit a dentist regularly is to save money. Plain and simple. By visiting the dentist twice a year, you're more likely to uncover and address potential problems before they require more costly interventions, invasive treatments. In other words, preventive maintenance for your mouth is not much different than preventive maintenance for your car. Like I say, the cost to change your oil regularly will be less than the cost to replace a failed engine due to neglect. So that's why it's important. You go every 6 months. And again, there are many programs out there too, because if you call your dentist office, some of them have information where they can tell you you can apply for like low cost dental care. And if you have like Medicaid, I think that covers dental supplies. Check with your primary doctor and look in the back of your insurance card. It'll always look in the back of your insurance card where it says member services, and see, like, can you tell me some doctors, some dentists in the area that have payment plan, low cost thing, because your primary care doctor can tell you. And if you're in a rubric practice, they have social workers working there also, so they can kind of give you more information about where you can go to get more assistance. Okay, so in conclusion, brush your teeth on and twice daily. Floss every time, especially go into bed. Floss. One thing I don't like is when people walk around with floss in their mouth. That just gets me. I don't know why. It's like floss it somewhere else. I don't think that's something you should be doing at the table at the cookout where everybody can see you. No, just floss somewhere. Go somewhere else and floss and throw the stuff away. Don't walk around with a pick in your mouth like that. I don't know why people do that. That's just one of my pet peeves. I don't know. Anyway, forgive me. So, but anyways, and visit your dentist as recommended. Also, your PCP can handle dental infections if you can't get to your dentist at time. But most times would handle the infection and then tell you have to follow with your dentist, because even though the infection is gone, there may be something else is causing. Because sometimes the infection, you have to treat them 3 or 4 times with antibiotics, and then that's even more important for them to go see their dentist to make sure everything else is okay there. Because if the infection is underneath the tooth, that may need to be taken out or gone in there and go ahead and clean completely in there. Okay. And again, like I said, your dental health can affect your overall health. So, so in conclusion, follow up with that, and make sure you take your kids, follow up, even elderly people. Please, people, you have elderly relatives at home, making sure if you see them not eating okay, don't just say, especially if they're having pain. If they don't want to eat certain food, that's fine. You make sure you cut it up in smaller pieces so it doesn't hurt their teeth. But if they're in a lot of pain, it's important that you take them to the dentist so they make sure to take away the pain, because you don't want somebody just sitting there saying, oh yes, I'm old now, so I don't have to worry about. No, you don't want them every day, a day in, a day out, suffering in pain because their teeth don't no longer fit their mouth. They may need dentures, they may need partials, they may need other things that would cause quality of life. Remember, quality of life. Okay. So thank you all for watching. Please like and follow. Please invite your friends. Again, I'm trying to get to at least 1,000 followers by the end of July, which is about 1 week, in about 1 week or so. So I'm counting on you, all of you who are my supporters and followers, and those who love me, those who tolerate me. Anyways, but I'm trying to do that. And I'm also on Facebook too. No, Facebook. I'm also on YouTube under the same name. So please go there and subscribe. I'm trying to build up my YouTube following. And for those of you on Focus Liberia who are watching with Focus in Liberia, thank you so much. I got almost like 1,000 views so far, so thank you all. For some people that may mean nothing, because I see other forums that do one show and they get 1,000 views, from 10,000 views, and also we're the little ones. They have like big content creators, we're the little ones, and we're the little baby ones. So okay, but I'm doing this, make sure help. And when you do like the forum, when you do like a page, when you do like a topic, not only you're not just liking it because your friends who are not friends of this, who are not members here, or who are not followers, they see that you like the post, and everybody can learn from it. So everything I talked about here, that's something that affects everybody or somebody in your life. So if you like it, you follow or you comment, that's just about liking or just sharing the topic that you found interesting. Other people can benefit from it too. I'm not saying I'm the only person on Facebook that can give health information. I'm just one of the few. And I'm just doing what I love to do. I love health teaching. Okay. So thank you all for watching. For those of you who watch with me, I say thank you. Let me just look in here one more time and see. Joseph Cole say good morning. He says. Good evening. Good evening. Good evening, Joseph. How are you? Hope all is well. Thank you. Thanks for watching. So let me go back here. And I did that. Okay, comments. Okay, so to all of you who have watched with me, I say thank you all so much. Please don't forget to share the show, invite others so we can have a big 1,000 followers party at the end. And again, call your doctor, call your dentist tomorrow. Make sure you have your planned visit for every 6 months. It's twice a year, every 6 months, and follow up as recommended. So for any, I had a couple of topics for a show. My friend. I said, can you please talk of this? This is something that bothers our community. So I will try to do that next Tuesday. If you have any topic for any shows that you want me to talk about, and if it's in my realm of teaching, I will be sure to look it up and I will bring it to you. So I want to be able to bring shows to you guys that you can learn from, and also that be beneficial to you or somebody you love. So thank you all again for watching tonight. I appreciate it. Love you all. Thank you all for your love and support. Invite others and please share the show. Okay. Thank you and good night. God bless. Bye bye.